Welcome to my channel. I am Dr. Sakib. Today we will learn about heart attack. In this video, we will talk about what is heart attack, causes of the heart attack, what are the symptoms, when to see a doctor, and what are the main causes, what are the risk factors, and what are the complications if we have a heart attack, and what are the prevention, and how to diagnose and its treatment. First question is, what is heart attack? Heart attack means when your heart muscle does not get enough blood and oxygen due to any reason. Next question is, what is the pathophysiology of the heart attack? Pathophysiology means how does the heart attack happens. A heart attack occurs when an artery that sends blood and oxygen to the heart is blocked. In our artery, some fatty cholesterol containing deposits build up over time, which makes plaques in our heart's artery. Sometimes these plaques ruptures and a blood clot can form. These clots can block arteries and causing a heart attack. The process of forming of plaques in our coronary artery is called atherosclerosis. So, main cause of heart attack is atherosclerosis. If our heart is completely blocked, this is called ST elevation myocardial infarction. If our heart is partially blocked, this is called non-ST elevation myocardial infarctions. Beside the atherosclerosis, there are other causes of the heart attacks. In this, main is coronary artery spasm. Second is certain infections and a disease called spontaneous coronary artery dissections. This is a life-threatening condition is caused by a tear inside a heart artery. Next question is, what are the risk factors? Risk factor means in which conditions you have a more chance of heart attack. First is age. If you have a more age, then you have a more chance of heart attack. High blood pressure, diabetes, metabolic syndrome, some kind of obesity, unhealthy diet, or and some physical inactivity. If you don't do some exercises, this is also you have a risk factor to have a heart attack. Next question is, what are the symptoms of heart attacks? Symptoms of heart attacks vary. Some people have mild symptoms, some have severe, some have no symptoms. But main symptom is chest pain that may feel like pressure, tightness, pain, squeezing, or itching. Pain or discomfort that spread to the shoulder, arm, then to the back, and can go to the neck and jaw, teeth, or sometimes to the upper belly. Number three is cold sweat. Next is fatigue, heartburn, sudden dizziness, nausea, shortness of breath. Women may have atypical symptoms such as brief or sharp pain felt in the neck, arm, or back. Sometimes the first symptom sign of a heart attack is sudden cardiac arrest. Cardiac arrest occurs when a heart suddenly or unexpectedly stops pumping. Next question is, what are the complications? Complications means is what kind of diseases can happen during this disease and after the treatment of the heart attack. In this is irregular or atypical heart arrhythmias, which we call arrhythmias, cardiogenic shock, heart failure, can happen pericarditis, and also can happen cardiac arrest. Next question is, what are the prevention? Prevention means what kind of things you can do to prevent this disease. To follow a healthy lifestyle and manage other health conditions, like if you have a diabetes or hypertension, you should manage the disease also and take medication as directed as your doctor has said to you. Next question is how to diagnose. Diagnose means how we know that this is a heart attack. But to diagnose a heart attack includes checking blood pressure and pulse and temperature. Tests are also done to see how the heart is beating and check overall heart health. Test includes first is ECG, electrocardiogram, second is blood test. We can do chest X-ray, echocardiogram, we can do cardiac CT scan and MRI and coronary catheterization. Next question is what is the treatment? It is an emergency state, so urgent treatment is needed to fix blood flow and restore oxygen level. So oxygen is given immediately. And in medications, there is aspirin. Aspirin reduces blood clotting. It helps keep blood moving through a narrowed artery. Some clot busters like thrombolytic or fibrinolytics. These drugs helps break up any blood clots that are blocking blood flow to the heart. Some other thinning medications, uh, a medicine called heparin, may be given by injection and IV route. Nitroglycerin, this medication opens up the blood vessels. This is a vasodilator. We can give morphine, beta blockers, and ACE inhibitors. Beside giving oxygen directly and some medications, we also can treat treat this disease by some surgical and other procedure like coronary angioplasty stenting, and also we can do the PCI, and we also can do the bypass surgery and treat this disease. And in the final, cardiac rehabilitation is also very important. All diseases which are mentioned in this video, I will put their names with their definitions in my description. You can check out from there. Thanks for watching. If you like my video, please subscribe and we will meet in next video. Thank you.